thank you again to everybody. What we wanted to do is finish up and have the four of us on here. We're going to see if we can bring Harry in virtually. And we're happy to just have a few minutes of open discussion about the book. Any questions, any burning questions that you have for any of us, we'd love to answer those now. And just an opportunity really to sort of celebrate the accomplishment of all of you, all the contributing authors, and to thank everybody that has taken their time to join us today. What I can say is that, we've got, I'm just opening the book up right now. There's 23 chapters, and I could give you an aha moment from each and every chapter. And so, whether you are looking at this from the healthcare provider, whether you're looking at it from the patient perspective, or whether you're looking at it for a look to the future, I'll just give you an example. Look to the future. One of the chapters is about a voice genome project and collecting a database of voice signals so that we can then essentially mine that database and look for patterns that could detect early disease. Things like that are so cutting edge. There's an aha moment in every single chapter. And so I'm just really proud of it, as you can tell. I'm so excited about being able to, although we couldn't do it personally, we're here, we're doing it virtually, we're launching the book, and I hope that this will create a lot of discussion around voice technology. We are on social media. If you are active on social media, we're using the hashtag #VoiceFirstHealth to join the discussion, and I encourage you to do that. And I think we have a question here. And here's the question. So I would like to know, the main pain point is to have healthcare providers accept this. How do we manage to change the mindset for this? Sandhya, do you want to take a stab at that?
Yeah. As I read that question, what really came to mind was being able to address the whole security and patient identification, that two-factor authentication that everyone's talking about. I think providers are going to want to have that in place. There's a lot of interest in personalizing it, making it in that way, from a patient's experience, it could meet their needs across different parts of their healthcare journey. And having that security and authentication addressed, I think, is going to increase the uptake by healthcare providers.
Yeah, and you can see their edit comments, accuracy and privacy as well. Yeah. Any other questions at all?
There's another question.
Yeah, let's throw this one up. So this question says, do we have any measurables yet for improved efficiencies? That's a great question. Anybody aware of any actual measurables for improved efficiencies coming out of this?
I think one measurable that with the small pilots that we have done at Mayo is looking at patient satisfaction and provider satisfaction. I think that is a metric that we want to capture. In terms of time efficiencies in the healthcare, in that encounter, I have not seen that. I think that would be a measurable that we would want to know, is did it reduce the time, reduce the clerical burden, and capture that level of data. That will require, I guess, some more sophisticated metric to measure, something to think about, but it's a great question.
Great. Here's an interesting question.
I think that some of these things we saw at Orlando Health as well, too, are good examples of that also, too, because they have some empirical data that they've done, too, with the use of the robot. But it's really about that voice, that warmth, that engagement, too, that you get from that, and having better scores on people's experience, their patient experience, and then also having some better outcomes for what's the data that's actually put into the electronic health record in automated fashion through that voice to all script interface.
Perfect. Question here from Kuma Crystal. Since technology evolves so quickly, how soon will we need to update the book? Well, there you go. That's a great question.
Constantly evergreen for the electronic version.
Yeah. Well, I know, David, you could probably address that better than I can in terms of updating the hard copy, but already we have begun updating some of the digital copies with some various things. So I think it's going to be a constant process with how the technology is evolving.
With the production method that Mike and the team use too, it's possible to do things like special editions of the book. So there could be one that has some additional chapters in it that are specific to a particular sub-aspect of voice technology in healthcare, or that has a particular organization. You see that we really did try and balance out the technology in here in the technology organizations. But if one wanted to put in a little bit more about Alexa or about some of the Google Assistant or other technologies too, that's a possibility because of the way that the rights are structured and because of the way the production was done too, with that maximum flexibility with this Intelligent Health series concept that Harry and the team at the Intelligent Health Association have been able to devise, and with the production methods that Mike and the team have come up with. So I do think it's possible to do some of those things and have this principle of evergreen in this too, as well as always going back to Teri's site, Voice First Health, and looking at some of the up-to-date podcasts, maybe adding to those too, so that you do have an evergreen sort of landing page for the book too, that also has the latest up-to-date information too.
Well, and and that really, I want to thank Teri for coordinating this. This is not easy to do, and boy, Teri, you really pulled this together beautifully. And David, just watching the way in which you joined, we were able to join virtually, have this agenda come together so nicely, and all the speakers were available. Wow, that's amazing technology that you should actually write about, so others can learn from you.
I think Audrey had an idea about that too in past email. Is that right, Teri?
Yeah.
So yeah.
Audrey had a great idea about writing this up as a way to share information now in this coronavirus era that we're in right now. So I bet we'll be participating in a lot more of these online conferences and events. So absolutely. Here's one more question. Jesus says, who should push to make voice technology more available in the healthcare sector? And I actually think it's everybody. It's everybody's responsibility.
Yeah, Harry said all of us too. Yeah.
Yeah. Everybody. I mean, that's really what the mission is with, if I just to take 2 seconds to plug my own website, Voice First Health. That's the mission of that, is to push the industry forward at the intersection of healthcare and voice technology. And so that really is what my podcast is all about, is interviewing people like all of you who are doing incredible things and just helping to get the word out about how disruptive voice technology is being and is going to be. And I think the more that we can push that forward as a community, more people are going to learn about it, more people are going to embrace it, and I think ultimately that's better for healthcare providers and patients.
Yeah. And Harry also says join the voice groups on LinkedIn, as well as even just seeing how we curated this book. We didn't just make it all technologists, all healthcare providers, or all patient perspective, or all accessibility and standards or law. We tried to get across the community. So we're so thankful for all of you who are doing that with us and for us. And we want to continue that cross interdisciplinary and interprofessional dialogue.
Wonderful.
And I just want to add, if all of our contributors all have great examples of where they had success and made a difference in the clinical or healthcare setting, those are the examples we need to continue to communicate and share. And I think that's when we're going to get more uptake of voice in healthcare.
What can I say? I want to thank everybody again for their time. It's been a lot of fun doing this, and we'll have to do it again very soon.
Thanks again, everybody. This was great that we all made time for this.
Thanks, everybody.
Thank you, everyone. Have a great rest of your day.
Take care.
Thank you, Harry.
Bye.
Bye-bye.